Altered Physiology, Mechanisms of Disease 2, Week 1, Episode 6, a continuation of our lectures on the MSK system with a focus on osteoporosis. You will recall from our preceding lecture that you can see definite changes in the bone microarchitecture. Looking at the screen here, you can see that there's essentially a thinning of the bones, and that is characterized by a reduction in bone mass and a disruption of that microarchitecture. That leads to an overall reduction in bone strength, and that is what places us at an increased susceptibility to fracture, even in cases of minimal trauma. Now, what you'll also notice on the screen is a diagram showing three different women, one who is 35, one who's 55, and one who is 65 plus. And so there's definitely a link with aging, particularly in women. We think about postmenopausal women being at increased risk for osteoporosis. Now, let's take a look here at the evidence behind this potential relationship. And one of the contentious issues among women has been the use of hormone replacement therapy, particularly once again in postmenopausal women. And the primary prevention of chronic conditions such as osteoporosis. So here was a systematic review published in JAMA back in 2017. And essentially what a systematic review does is it takes a number of articles that meet a certain inclusion criteria. So for example, articles that all study postmenopausal women who are on hormone replacement therapy. And it looks at all of the various outcomes that each individual study evaluates. So one such outcome could be risk of fracture. And what this study did, and so you can see the flow diagram on the right-hand side of your screen, which essentially shows that nearly 7,000 articles were screened, and then in the end, I believe they had under 100 articles that were included in their final analysis. What they looked at was the effectiveness of hormone replacement therapy on a number of different outcomes. So as I mentioned, one such outcome would be fracture risk related to osteoporosis. And what they found was that there was a high level of evidence for risk reduction among those women who were taking estrogen versus a placebo, which could be something like a harmless sugar pill. And they did find, in fact, that among a number of trials, that there was that reduction in risk, indicating as a result that there was a benefit of actually using estrogen-based hormone therapy in postmenopausal women. When they look at a number of the other outcomes, however, the evidence is less clear. In fact, when you look at something such as urinary incontinence, the opposite was true. And once again, you can see this in the diagram or figure on your far right. So why exactly is estrogen associated with aging and bone remodeling? Well, the removal of estrogen, which happens with the onset of menopause, increases the rate of bone turnover, inducing a remodeling imbalance by essentially increasing the amount of time when the bone spends in that kind of resorption phase where the osteoclasts are more dominant, and at the same time shortening the bone formation phase where those osteoblasts would be more dominant. Therefore, as a result, the magnitude of resorption outweighs the magnitude of bone formation. You can see on the bottom of this diagram how bone loss is minimal early in life, So in one's, say, 30s and 40s, but as they approach menopause, there is a steep decline in bone bone mass. So how exactly does hormone replacement help with osteoporosis? Well, it's a very complex relationship, so I don't expect you to know every single diagram feature of this diagram. But what we can see is that estrogen can have an effect on some of your inflammatory cytokines. So earlier in the lecture, we talked about tumor necrosis factor alpha, and we also talked about some of your interleukins, and we also talked about the rank L cytokine as well. And so it is these major cytokines in the bone microenvironment that help to regulate our bone remodeling. And so it seems more likely that estrogen inhibits bone resorption through a number of different regulatory pathways. We're going to end off this particular lecture episode by looking at the treatment of osteoporosis. So there's a number of different treatments available and approved for use in Canada, one of which are your bisphosphonates. And there are 4 different drugs in particular that are used. And what they do is that they bind to the surface of the bones to slow down those osteoclasts. And as we know, it is the osteoclasts which are primarily responsible for the breakdown of bone. And this allows your osteoblasts, once again, to work efficiently and to really contribute to bone formation. All of these drugs have been shown to reduce fracture risk, particularly at the spine, but many of which also contribute to a reduced fracture risk at the hip. Now, occasionally there are side effects, as with any particular medication. So that is something to obviously be mindful of. But at the current stage, that would be one form of drug treatment that can be used against the progression of osteoporosis particularly among our postmenopausal women who seem to be at very high risk.